Welcome to the Advanced Medical Billing and Coding Professional course, presented by CDG Training. This program is designed to help you master the healthcare revenue cycle, medical coding, claims processing, and reimbursement management. This section sets the stage for your journey into medical billing and coding. It provides essential context, career relevance, and an overview of the healthcare ecosystem you'll navigate throughout this course. In this course, you'll gain insights into medical coding fundamentals, billing processes, revenue cycle management, compliance, auditing, and insurance claims processing. Each module is designed to equip you with the skills needed in this essential field. Accurate medical billing and coding are crucial for a healthy healthcare revenue cycle. They help reduce claim denials, support compliance, and improve financial performance, ensuring healthcare organizations operate efficiently. The healthcare revenue cycle involves a network of stakeholders, each playing a distinct role. Understanding these interactions is key to effective billing and coding practices. Medical billing and coding have evolved significantly, from paper-based systems to digital management and smart reimbursement systems. This evolution highlights the importance of adapting to new technologies in healthcare. The AMBCP credential opens doors to various rewarding careers in healthcare settings, from medical coders to revenue cycle specialists. This course prepares you for advancement across these high-demand roles. Welcome to Chapter 1, where we delve into the essentials of medical billing, coding, and revenue cycle management. This chapter lays the groundwork for understanding how healthcare services are documented, coded, billed, and reimbursed, highlighting the professionals who make it all work. Every healthcare service must be accurately documented, coded, billed, and reimbursed. Medical billing and coding professionals bridge the gap between healthcare providers and insurance payers, ensuring proper reimbursement while maintaining compliance with healthcare regulations. Medical billing translates healthcare services into billable claims for insurance reimbursement. This process ensures every service is captured, coded, and submitted accurately, allowing providers to be compensated in a timely manner. Medical coding converts diagnoses, procedures, and treatments into standardized alphanumeric codes. Accurate coding is crucial for reimbursement, clinical documentation, and healthcare analytics. Coding always precedes billing. Clinical documentation is transformed into standardized codes, which are then used to generate claims for reimbursement. This sequential relationship ensures accuracy at every stage. Revenue cycle management optimizes the financial processes in healthcare, from patient registration to final payment. It ensures that healthcare organizations maximize revenue and improve financial performance. Revenue cycle management is vital for improving financial stability, reducing revenue leakage, and enhancing operational efficiency. It supports better patient experiences and strengthens organizational sustainability. The revenue cycle involves interconnected stages, each dependent on the accuracy of the previous one. From patient registration to billing, each step is crucial for timely reimbursement. Patients, providers, coders, billers, insurers, and government programs all play crucial roles in the medical billing and coding process. Each stakeholder ensures accuracy and compliance at every level. Medical coders review clinical documentation, assign diagnosis and procedure codes, and ensure coding accuracy. Their work is essential for accurate billing and compliance. Medical billers prepare claims, submit them to payers, manage payments, and handle denials. Their role is crucial in ensuring that healthcare providers receive timely and accurate reimbursement. Accurate coding relies on complete and clear clinical documentation. This documentation forms the foundation for coding accuracy and reimbursement success. ICD-10-CM, CPT, and HCPCS Level 2 are the primary coding systems in the U.S. Each serves a distinct purpose and is governed by its own set of guidelines. A claim is a formal request for payment submitted to an insurance company. It includes patient information, provider details, diagnosis and procedure codes, and charges. Incomplete documentation, coding errors, claim denials, regulatory changes, and compliance risks are common challenges in medical billing and coding. Addressing these is crucial for accuracy and efficiency. High coding accuracy leads to increased reimbursement, reduced claim rejections, faster payments, better compliance, and improved revenue capture. It's essential for financial health. Compliance is a fundamental obligation for every billing and coding professional. Ethical practices protect patients, providers, and the integrity of the healthcare system. Electronic health records, practice management systems, revenue cycle platforms, and AI-assisted coding tools are key technologies supporting billing and coding. The medical billing and coding field offers diverse career paths, from entry-level coding positions to senior revenue cycle leadership roles. Opportunities abound for those with expertise in healthcare reimbursement. Emerging technologies like AI, automated coding systems, predictive analytics, and revenue cycle automation are reshaping the field. Professionals must stay informed to succeed. This chapter covered the fundamentals of medical billing, coding, and revenue cycle management, highlighting their roles in healthcare reimbursement and financial sustainability. Future trends and technologies are transforming the landscape, offering new opportunities and challenges. Welcome to Chapter 2, where we delve into the essential aspects of healthcare terminology, anatomy, and medical documentation. This chapter is crucial for advanced medical billing and coding professionals. To excel in medical billing and coding, professionals must grasp the language of healthcare, including medical terminology, anatomy, and documentation. Accurate coding starts with this foundational knowledge. A strong command of medical language is the backbone of accurate coding decisions. From documentation review to claim submission, terminology knowledge bridges gaps and improves outcomes. Medical terms often derive from Greek and Latin roots. Understanding prefixes, root words, suffixes, and combining vowels helps decode complex terms, enhancing clinical documentation. Prefixes modify the meaning of medical terms, allowing coders to quickly interpret clinical language. Mastering these prefixes is crucial for accurate coding. Suffixes describe conditions or procedures, essential for accurate code selection. Recognizing these endings ensures precise documentation and coding. Medical coders must understand major body systems to accurately interpret diagnoses. Each system has unique terminology and coding requirements. Directional terms are crucial for locating body structures in medical reports. Mastering these terms ensures precise coding and interpretation of clinical data. The cardiovascular system is central to circulation. Understanding its terminology is vital for coding diagnoses like hypertension and myocardial infarction. The respiratory system facilitates gas exchange. Coders frequently encounter related diagnoses, making understanding this terminology essential. The digestive system processes nutrients. Coders must be familiar with its structures and conditions for accurate coding in various settings. Orthopedic conditions require detailed anatomical knowledge for precise coding. Understanding musculoskeletal terminology is essential for accuracy. The nervous system controls body functions. Accurate coding requires understanding its terminology and common neurological diagnoses. Medical abbreviations save time but require accurate interpretation to avoid errors. Coders must understand these abbreviations for precise coding. Clinical documentation records patient health information, forming the basis for medical coding. Understanding its components is crucial for coders. Healthcare encounters generate various documentation types, each serving a unique purpose. Coders must interpret these types accurately for effective coding. Documentation and coding are inseparable. Accurate documentation supports coding, ensuring compliance and proper reimbursement. Identifying and addressing documentation deficiencies is crucial for accurate coding. Proactive improvement programs can significantly reduce denial rates. Electronic health records have revolutionized documentation, improving quality and accessibility. EHRs support seamless integration across healthcare settings. Adhering to best practices ensures clinical records accurately reflect care provided. This supports coding accuracy and compliance with regulations. In summary, understanding medical terminology, anatomy, and documentation is essential for accurate coding. These skills ensure proper reimbursement and compliance. Welcome to Chapter 3, where we delve into the essentials of ICD-10-CM diagnosis coding, a crucial skill in modern healthcare settings. ICD-10-CM coding is vital for medical professionals, providing a universal language to classify diseases and conditions. Accurate coding ensures proper reimbursement and quality healthcare reporting. ICD-10-CM stands for the International Classification of Diseases, 10th revision, clinical modification. It's developed for various purposes, including disease classification and health reporting. ICD-10-CM coding supports medical necessity, enables accurate reimbursement, and facilitates healthcare analytics. It also ensures regulatory compliance and improves clinical documentation. ICD-10-CM codes are structured with characters that provide specific information about diseases. This structure allows for detailed and precise coding, essential for effective healthcare management. The organization of ICD-10-CM codes involves assignments, subcategories, categories, and chapters, each adding layers of detail and specificity to patient encounters. ICD-10-CM chapters cover a wide range of medical conditions, from infectious diseases to injuries and external causes, providing a comprehensive coding framework. Detailed coding enhances outcomes across reimbursement, compliance, and data quality. Specific codes lead to better reimbursement and clinical reporting. Adhering to ICD-10-CM coding guidelines ensures accuracy and compliance. These guidelines cover specificity, documentation, and the use of official coding rules. Understanding the difference between principal and secondary diagnoses is crucial for accurate coding and reimbursement. Each plays a distinct role in patient care documentation. Coding signs and symptoms is essential when a definitive diagnosis isn't established. This ensures accurate documentation and treatment planning. ICD-10-CM conventions guide the coding process, ensuring clarity and accuracy. These include notes, exclusions, and instructions for code sequencing. Laterality designations in ICD-10-CM ensure precise coding for conditions affecting specific body sides, enhancing treatment accuracy. Chronic diseases require continuous coding throughout a patient's care. Accurate coding is essential for effective management and treatment planning. Acute conditions demand the highest specificity in coding to avoid claim denials and ensure proper treatment documentation. Injury coding involves understanding the location, cause, and severity of injuries. Accurate coding supports effective treatment and reimbursement. A consistent coding workflow ensures accuracy and compliance. This involves reviewing documentation, identifying diagnoses, and applying guidelines. Avoiding common coding errors is crucial for maintaining accuracy and compliance. Regular audits help identify and correct these issues. Technology plays a vital role in diagnosis coding, from AI systems to EHR integration, enhancing accuracy and efficiency. The future of ICD coding is shaped by AI, NLP, and EHR integration, promising a more intelligent and automated workflow by 2030. In summary, mastering ICD-10-CM coding involves understanding its structure, guidelines, and the role of technology in enhancing accuracy and efficiency. Welcome to Chapter 4, where we delve into the CAPTAIN and HCPCS procedure coding systems, essential for healthcare reimbursement and compliance. Procedure coding is crucial for identifying the services, procedures, and supplies provided to patients. While ICD-10-CM identifies the why, CPT and HCPCS codes define the what. CPT, or current procedural terminology, is developed by the AMA to report medical procedures and services, supporting billing and standardizing healthcare reporting. CAPTAIN coding ensures accurate reimbursement, reduces claim denials, and supports regulatory compliance, making it vital for healthcare organizations. CAPTAIN codes are structured with 5-digit numeric codes, divided into 3 categories for different types of procedures and services. Category I codes form the backbone of Captain coding, covering mainstream medical services and procedures across various specialties. Evaluation and management codes cover a range of services from office visits to preventive care, essential for patient interaction documentation. Surgical Captain codes require detailed documentation to ensure accurate code assignment, covering various body systems and procedures. Radiology codes encompass a broad range of diagnostic services, each requiring precise documentation for accurate coding. Laboratory and pathology codes cover a wide range of testing and diagnostic services, crucial for accurate medical analysis. The medicine section of Captain codes includes a variety of specialty services not covered under other categories, from immunizations to dialysis. Category II codes support quality initiatives but generally do not affect reimbursement directly, focusing on performance measurement. Category III codes are temporary and track emerging technologies and procedures, aiding in data collection for future code development. HCPCS codes report services and supplies not covered by CPT, filling critical gaps in healthcare billing. HCPCS Level 1 and 2 codes cover a wide range of services, from physician services to non-physician products and supplies. HCPCS Level 2 categories include a variety of codes for medical equipment, drugs, and supplies, essential for comprehensive healthcare billing. Modifiers in Captain and HCPCS codes provide additional information about the circumstances of a service, ensuring accurate billing. Accurate documentation is crucial for procedure coding, preventing claim denials and ensuring compliance with healthcare standards. Common coding errors can lead to claim denials and financial losses, emphasizing the need for accuracy and attention to detail. Advancements in technology, like AI and natural language processing, are reshaping the future of procedure coding, enhancing accuracy and efficiency. CPT and HCPCS coding systems are foundational for healthcare reporting and reimbursement, making mastery of these systems essential for professionals. Welcome to Chapter 5, where we delve into the medical billing process and claims lifecycle. This comprehensive guide will help you understand how healthcare services are transformed into financial transactions, from patient registration through to final payment collection. Medical billing is crucial in transforming healthcare services into financial transactions. Each patient encounter generates information that must be accurately processed to ensure providers receive reimbursement for services rendered. A successful billing process depends on accurate patient information, proper coding, clean claim submission, and efficient payment collection. Medical billing involves preparing, submitting, tracking, and collecting payments for healthcare services provided to patients. Its core objectives include generating revenue, reducing claim rejections, improving cash flow, supporting compliance, and enhancing patient financial experience. The medical billing process is intricately connected to the revenue cycle, supporting every stage from documentation to collections. Each step, from capturing patient information to following up on outstanding balances, is vital for financial success. Every healthcare claim passes through a defined series of stages before reimbursement is achieved. Understanding this end-to-end lifecycle is essential for efficient revenue cycle management. Accurate registration is the foundation of a clean claim. Errors at this stage cascade through the entire billing lifecycle, causing delays and denials. Collecting demographic information, verifying contact details, obtaining insurance information, and collecting consent forms are crucial steps. Before any service is rendered, verifying a patient's insurance eligibility is critical to preventing costly claim denials downstream. Confirming coverage, verifying benefits, checking deductibles, reviewing co-payments, and identifying authorization requirements are essential tasks. Prior authorization is a payer requirement for certain services to receive approval before they are performed. Skipping this step is a common cause of claim denials. Determining authorization needs, submitting clinical documentation, obtaining payer approval, and documenting authorization numbers are key steps. Charge capture involves recording all billable services provided during patient care, ensuring no revenue is lost due to undocumented or missed charges. This includes procedures, consultations, supplies, medications, and diagnostic services. MedicalCoding translates clinical documentation into standardized codes that communicate diagnoses and procedures to payers. Assigning ICD-10-CM, CPT, and HCPCS codes, validating documentation, and ensuring coding accuracy are crucial steps. A complete and accurate claim contains all required data elements. Missing or incorrect information at this stage results in rejections before the claim even reaches the payer. Different healthcare settings require different claim formats and reimbursement processes. Understanding claim types ensures proper submission and maximizes reimbursement. Electronic claim submission has revolutionized the billing process, replacing paper-based workflows with faster, more accurate digital transmission. This shift is now the industry standard, offering faster processing, reduced errors, and higher efficiency. Healthcare clearinghouses serve as the critical intermediary between providers and payers, validating, standardizing, and routing claims to maximize acceptance rates. They ensure claim validation, error detection, data standardization, and proper routing to payers. Adjudication is the insurance company's formal review and processing of submitted claims to determine the amount payable under the patient's coverage terms. Key review areas include eligibility, medical necessity, coding accuracy, coverage rules, and contract compliance. After adjudication, every claim receives one of 5 possible outcomes. Understanding these outcomes is essential for effective follow-up and revenue recovery. Payment posting involves recording and reconciling all payments received from insurance companies and patients. Accurate payment posting ensures financial records reflect true account balances. After insurance adjudication, any remaining patient responsibility must be clearly and collected efficiently. Transparent billing practices improve both satisfaction and collection rates. Billing errors are among the most significant threats to healthcare revenue. Identifying and addressing root causes proactively is essential for maintaining a healthy revenue cycle. Emerging technologies are transforming the medical billing landscape, automating manual processes, reducing errors, and enabling data-driven revenue cycle management at scale. The medical billing process and claims lifecycle form the financial backbone of healthcare organizations. Mastering each stage ensures financial sustainability while supporting quality patient care. Explore the intricate world of insurance systems, payers, and reimbursement methodologies in healthcare. This chapter provides a comprehensive guide to understanding how healthcare organizations are compensated for patient care, from insurance structures to modern payment models. Healthcare providers deliver services first and receive payment later. Understanding insurance systems and reimbursement methodologies is crucial for comprehending how healthcare organizations are compensated for patient care. This insight is essential for successful medical billing and revenue cycle management. Health insurance is a financial arrangement that helps cover the cost of medical services provided to patients. It improves access to healthcare, reduces financial burden, supports healthcare providers, and manages healthcare costs. Insurance plays a vital role in healthcare by facilitating access, supporting provider revenue, reducing patient financial risk, encouraging preventive care, and improving healthcare outcomes. It ensures that healthcare organizations can invest in quality care and patients can access necessary services. There are various types of health insurance plans, each serving different populations and operating under different coverage rules, network structures, and reimbursement frameworks. Understanding these distinctions is crucial for accurate billing. Successful reimbursement depends on seamless coordination among all 6 stakeholder groups: patients, healthcare providers, insurance companies, government agencies, third-party administrators, and clearinghouses. Breakdowns at any node can delay or deny reimbursement. A payer is an organization responsible for reimbursing healthcare providers for services rendered to covered patients. They include commercial insurers, government programs, managed care organizations, and self-insured employers. Government healthcare programs like Medicare, Medicaid, CHIP, and TRICARE and VA play a significant role in healthcare reimbursement. Compliance with federal billing regulations is critical for all providers involved. Managed care organizations coordinate care delivery and reimbursement to control costs and improve outcomes. Each model balances provider network flexibility against premium control and patient choice. Understanding insurance terminology is crucial for coders and billers. Key terms include premium, deductible, copayment, coinsurance, out-of-pocket maximum, prior authorization, coordination of benefits, and explanation of benefits. Provider participation models include in-network providers, out-of-network providers, participating providers, and non-participating providers. Each model affects reimbursement rates and patient costs differently. Healthcare reimbursement is rapidly shifting from volume-based payments toward value-based care models that reward quality outcomes over quantity of services delivered. Understanding this spectrum is essential for navigating modern healthcare finance. Fee-for-service remains the most widely recognized reimbursement model and forms the baseline against which all alternative payment models are compared. It is easy to understand and administer but may encourage higher service utilization. Capitation is commonly used in HMO arrangements and is a cornerstone of managed care reimbursement strategy. It involves a fixed per-member payment, with providers assuming risk and focusing on cost control and population health. Bundled payment programs have demonstrated measurable reductions in episode costs while maintaining or improving patient outcomes. They encourage all parties to collaborate efficiently. Value-based models require integrated care teams and robust data sharing to manage payment incentives across the continuum of care. Providers are rewarded for achieving measurable improvements in patient health outcomes. The reimbursement workflow begins the moment a patient receives care and ends when payment is posted to the provider's account. Each step requires accuracy and compliance to avoid delays, denials, or underpayments. Both the explanation of benefits, EOB, and electronic remittance advice, ERA, are critical tools for revenue cycle management. The EOB supports patient communication while the ERA drives back-office payment reconciliation. Common reimbursement challenges include claim denials, coding errors, prior authorization failures, timely filing limits, and coordination of benefits errors. Addressing these issues is crucial for efficient revenue cycle management. Future trends in healthcare reimbursement include AI-powered claims processing, predictive revenue analytics, smart reimbursement platforms, and blockchain for claims integrity. These innovations aim to enhance efficiency and accuracy in the reimbursement process. Insurance systems, healthcare payers, and reimbursement methodologies form the foundation of healthcare finance. Understanding these elements is crucial for accurate claims processing, maximizing revenue, and supporting organizational financial sustainability. Explore how healthcare organizations manage the financial engine that connects patient care to organizational sustainability. Revenue cycle management ensures services are accurately documented, billed, and reimbursed, forming the financial backbone of healthcare. RCM involves managing all administrative and clinical functions associated with patient service revenue generation. Objectives include maximizing revenue collection, improving cash flow, and enhancing billing accuracy. The revenue cycle encompasses 8 critical stages from patient scheduling to payment collection. Front-end accuracy is crucial to prevent errors that can cascade through the revenue cycle. Mid-cycle processes ensure documentation quality directly affects reimbursement outcomes. The back end of the revenue cycle requires accurate posting and strategic denial management. Monitoring KPIs helps identify performance gaps and drive improvements in the revenue cycle. Clean claims are processed faster, reducing administrative burden and accelerating reimbursement timelines. Effective AR management is critical to maintaining healthy cash flow and financial stability. A proactive denial management program can recover lost revenue and improve future claim performance. Identifying and closing leakage points is essential to maximizing financial performance. Transparent billing and flexible payment options enhance patient satisfaction and financial experience. Compliance protects against financial penalties and reputational damage, serving as a vital revenue protection strategy. Data-driven financial reporting transforms raw data into actionable intelligence for strategic decisions. Systematic payer performance management enables better contract negotiation and collection efforts. RCM automation reduces operational costs while improving collections and reimbursement speed. Building a high-performance revenue cycle involves process standardization and continuous improvement. The future of RCM will be defined by intelligent automation and predictive analytics. Optimized revenue cycle management enhances patient care, financial resilience, and organizational health. In this chapter, we delve into the intricacies of claims processing, denial management, and appeals. Our goal is to provide a comprehensive guide to maximizing reimbursement, reducing denials, and building a resilient revenue cycle. Every claim matters in healthcare organizations, as even minor errors can lead to significant financial consequences. Effective claims processing and denial management are crucial for maintaining healthy cash flow and maximizing reimbursement. Claims processing involves a systematic review, validation, adjudication, and reimbursement of healthcare claims. A well-structured workflow ensures efficient movement from creation to payment, minimizing delays and maximizing collections. The claims lifecycle includes several stages, from claim creation to appeals and follow-up. Understanding each stage helps identify bottlenecks, reduce processing time, and improve overall reimbursement performance. A clean claim is submitted correctly the first time, ensuring faster reimbursement, lower administrative costs, higher collection rates, and reduced denials. It's essential for efficient revenue cycle management. Before submission, a claim must pass through a rigorous validation process to ensure accuracy and completeness. This includes verifying patient information, insurance eligibility, coding accuracy, documentation, and compliance. Clearinghouse review and validation help identify and correct errors before claims reach insurance companies. This process saves significant time and administrative costs by ensuring claims are accurate and complete. Claims adjudication is the process where an insurance payer evaluates a submitted claim and determines the appropriate reimbursement amount. It's a critical decision point in the claims lifecycle. After adjudication, claims can have several outcomes, such as approved, partially paid, denied, rejected, pending, or requiring more information. Understanding these outcomes is essential for effective follow-up and revenue recovery. Claim denials occur when a payer refuses reimbursement for part or all of a healthcare claim. Understanding why denials matter and the cost of inaction is crucial for revenue recovery. Understanding the root causes of claim denials is the first step toward building an effective prevention strategy. Coding errors and eligibility issues are among the most frequent and preventable denial drivers. Coding-related denials are among the most preventable causes of reimbursement delays. Regular coding audits and ongoing staff education are the most effective countermeasures. Documentation-related denials often result from incomplete medical records or missing clinical notes. Ensuring detailed, comprehensive documentation is critical to first-pass resolution. A structured denial management process transforms claim recovery into a proactive cycle, reducing future denials and accelerating reimbursement. It involves identifying denials, categorizing them, investigating root causes, and correcting errors. Root cause analysis for denials involves identifying trends and addressing errors systematically. By understanding the sources of denials, organizations can implement effective solutions and improve revenue cycle performance. Appeals management is a powerful tool for recovering lost reimbursement. A well-prepared appeal can overturn a denial and recover revenue that would otherwise be lost. There are various types of appeals, including informal, formal written, medical necessity, administrative, and secondary review requests. Each type serves a specific purpose in the appeals process. Building a strong appeal involves reviewing the denial reason, gathering supporting evidence, preparing a compelling letter, and submitting within deadlines. A systematic approach to appeals management delivers measurable financial returns. Denial prevention strategies include staff training, coding audits, documentation improvement, eligibility verification, automated claim scrubbing, and performance monitoring. These strategies significantly reduce denial rates and improve first-pass resolution. AI-powered claims review and the future of denial management involve predictive denial scoring, natural language processing, automated appeal letter generation, real-time payer policy monitoring, and machine learning-driven root cause analysis. In summary, claims processing, denial management, and appeals are critical components of the revenue cycle. By reducing errors, preventing denials, and effectively managing appeals, healthcare organizations can improve reimbursement performance and financial sustainability. Welcome to Chapter 9, where we delve into the critical aspects of compliance, healthcare regulations, and coding ethics. This chapter provides a comprehensive guide to ethical billing, regulatory adherence, fraud prevention, and professional standards in medical billing and coding. Compliance ensures that all activities in medical billing and coding are accurate, ethical, and legal. Strong compliance programs protect patients, healthcare providers, and organizations from fraud, penalties, audits, and legal risks. Let's explore how compliance reflects true services rendered and guides professional integrity. Healthcare compliance involves adhering to laws, regulations, standards, and ethical guidelines that govern healthcare operations. It is the backbone of every trustworthy healthcare organization. Key goals include protecting patients, preventing fraud, ensuring accurate billing, supporting ethical practices, and maintaining regulatory compliance. Compliance is crucial in preventing fraud and abuse, protecting organizational reputation, reducing financial penalties, improving coding accuracy, supporting patient trust, and ensuring legal compliance. Each of these elements plays a vital role in maintaining the integrity of healthcare operations. Healthcare organizations operate within a complex regulatory ecosystem involving government agencies, insurance payers, professional bodies, and accreditation organizations. Understanding this environment is essential for navigating the intricate web of regulations and standards. Key healthcare laws and regulations include fraud prevention laws, healthcare privacy regulations, medical record requirements, insurance compliance rules, and healthcare billing regulations. Each plays a critical role in ensuring ethical and legal healthcare practices. Medical billing and coding compliance focuses on accurate coding, complete documentation, claim integrity, and audit readiness. These focus areas ensure that billing practices are transparent, accurate, and aligned with regulatory standards. Fraud, waste, and abuse represent the three major categories of improper healthcare spending. Each carries distinct characteristics and consequences for organizations and patients alike. Understanding these categories is crucial for preventing unethical practices. Fraudulent billing practices such as upcoding, unbundling, phantom billing, and duplicate claims can lead to significant financial and reputational damage. Identifying and preventing these practices is essential for maintaining ethical billing standards. Upcoding and downcoding involve assigning codes that result in higher or lower reimbursement than warranted. Accurate coding protects the provider, the patient, and the integrity of the entire healthcare reimbursement system. Adhering to the golden rule of coding is essential. Medical necessity requires that services be reasonable, necessary, and supported by clinical documentation. This ensures that all procedures performed are clinically indicated and documented with sufficient detail, aligning with accepted guidelines. Proper documentation is the legal and clinical record of care. Accurate records, timely entries, and record retention are fundamental rules of healthcare billing compliance. Without documentation, reimbursement is not possible. Protecting patient information is both a legal obligation and an ethical imperative. HIPAA and related regulations set strict requirements for handling, storing, and transmitting protected health information, FI. Ethical principles such as honesty, accountability, patient confidentiality, accuracy, integrity, and professional responsibility guide medical coding practices. Upholding these principles ensures ethical behavior and accurate representation of coded services. Coding ethics and professional conduct involve coding what is documented, avoiding assumptions, maintaining professional independence, and reporting compliance concerns. These practices ensure accuracy and integrity in medical coding. Compliance audits are systematic reviews of coding, billing, documentation, and reimbursement practices to assess accuracy, identify errors, and ensure adherence to regulatory requirements. They can be triggered by various factors, including statistical anomalies and whistleblower complaints. When audits identify issues, organizations must respond with structured corrective action plans. Proactive responses to audit findings can prevent significant financial and reputational costs. A robust compliance program includes written policies, enforcement discipline, corrective action, reporting mechanisms, compliance officers, staff training, and internal monitoring. These elements work together to ensure adherence to standards and regulations. Modern compliance tools, including AI-powered monitoring and risk detection systems, enhance oversight and improve detection accuracy. Technology plays a crucial role in managing compliance efficiently and effectively. Future trends in healthcare compliance include AI compliance auditing, predictive risk monitoring, digital governance platforms, real-time coding validation, and advanced data privacy controls. These innovations are shaping the future of compliance. In summary, compliance, healthcare regulations, and coding ethics are essential for maintaining accurate billing, protecting patient information, preventing fraud, ensuring reimbursement integrity, and supporting ethical healthcare operations. Every coding and billing professional plays a critical role in upholding these standards. Explore the transformative impact of digital systems on healthcare documentation, coding, billing, and revenue cycle management. Healthcare organizations are increasingly relying on digital systems to manage patient information, streamline documentation, and enhance billing processes. These technologies improve efficiency, accuracy, compliance, and revenue cycle performance. Electronic health records, EHRs, are digital versions of patients' medical histories, maintained by healthcare providers. They serve as a central hub for clinical information, enabling providers to access comprehensive records instantly and securely. EHRs offer numerous benefits, including improved documentation accuracy, faster access to information, better care coordination, enhanced patient safety, improved coding accuracy, and regulatory compliance. A fully integrated EHR platform connects clinical, administrative, and financial functions through specialized modules that work together seamlessly. Accurate EHR documentation directly impacts coding accuracy and reimbursement success. It includes progress notes, nursing records, physician documentation, procedure documentation, and discharge summaries. Integrating EHR documentation with medical coding creates a streamlined workflow that improves accuracy and reduces manual effort. This includes automated documentation review, diagnosis identification, procedure identification, coding assistance, and documentation validation. A practice management system, PMS, is software used to manage administrative and financial operations within healthcare organizations. It supports scheduling, billing, claims processing, and reporting. Practice management systems manage patient appointments, provider availability, insurance verification, claims management, payment collection, and reporting and analytics. EHR and PMS platforms often integrate closely, offering distinct yet complementary purposes within healthcare organizations. EHR focuses on clinical documentation and decision support, while PMS handles administrative and financial management. Healthcare billing software generates claims, tracks payments, manages denials, produces reports, and supports the revenue cycle by integrating with EHR and PMS. Electronic claims management systems significantly reduce claim errors and reimbursement delays compared to manual processes. They include claim creation, claim scrubbing, claim submission, and payment reconciliation. Comprehensive RCM platforms unify all financial operations from patient registration through final payment, providing end-to-end visibility and control. Healthcare interoperability enables different systems and organizations to exchange, interpret, and use shared data effectively, a critical capability for modern care delivery. Healthcare organizations are among the most frequently targeted sectors for cyberattacks. Protecting patient data is both a regulatory requirement and an ethical obligation. AI is rapidly transforming healthcare billing and coding by automating complex tasks, improving accuracy, and enabling predictive capabilities that were previously impossible. RPA deploys software robots to perform repetitive, rule-based tasks with speed and precision, freeing healthcare staff to focus on higher-value activities. Patient portals empower individuals to actively participate in their healthcare experience, from scheduling appointments to paying bills, all through a secure digital interface. EHR and PMS deployments require significant capital investment in software, hardware, and infrastructure. User adoption, cybersecurity risks, data migration, regulatory compliance, and staff training are key challenges in digital healthcare systems. The next decade will bring transformative advances in healthcare revenue cycle technology, driven by artificial intelligence, automation, and emerging digital platforms. Electronic health records, practice management systems, and digital billing technologies have become essential tools for modern healthcare organizations. Mastery of these digital systems is a critical competency for healthcare and coding professionals in today's technology-driven environment. Welcome to Chapter 11, where we delve into coding audits, quality assurance, and risk management. This chapter provides a comprehensive guide to maintaining coding accuracy, ensuring compliance, and managing financial and regulatory risks in healthcare organizations. Medical coding is crucial for reimbursement, compliance, and organizational reputation. Coding audits and quality assurance programs help healthcare organizations maintain accuracy and reduce financial and regulatory risks. Regular audits ensure coding practices remain accurate and compliant with industry standards. A coding audit is a systematic review of coded healthcare records to verify coding accuracy, documentation support, compliance, and reimbursement integrity. This process involves reviewing records, analyzing findings, correcting errors, and improving processes to enhance coding accuracy and performance. Coding audits are vital for improving reimbursement accuracy, reducing claim denials, strengthening compliance, detecting errors early, supporting continuous improvement, and enhancing revenue integrity. They ensure claims reflect the true complexity of care delivered and protect the organization's financial health. There are various types of coding audits: internal audits conducted by organization staff, external audits by independent auditors, prospective audits before claim submission, and retrospective audits after claim processing. Each type serves a unique purpose in maintaining coding accuracy and compliance. The coding audit process involves selecting records, reviewing documentation, verifying codes, identifying variances, reporting findings, and implementing corrections. This structured approach ensures accurate coding and compliance with healthcare standards. Documentation review is crucial during audits, as most coding errors stem from incomplete or unclear documentation. Key sources include physician notes, progress notes, and discharge summaries. Thorough documentation review is essential for an effective coding audit program. Common coding errors include incorrect diagnosis codes, procedure codes, missing modifiers, undercoding, overcoding, and sequencing errors. Understanding these errors helps organizations target training and audit resources effectively, improving accuracy and compliance. Undercoding and overcoding can significantly impact healthcare organizations financially and legally. Accurate coding is not just a billing function, it is a compliance and patient safety imperative. Both types of errors can lead to revenue loss and compliance violations. Quality assurance in medical coding involves monitoring and improving coding accuracy and consistency across all clinical service lines. The goals include accuracy, consistency, compliance, and continuous improvement, ensuring codes reflect documented services and adhere to regulatory requirements. Key coding quality metrics include coding accuracy rate, compliance rate, productivity rate, denial rate, and audit scores. These metrics help measure performance and identify areas for improvement, ensuring high standards in coding practices. Quality improvement programs include staff training, documentation improvement, coding education, audit feedback, and performance monitoring. These programs help organizations achieve higher audit scores and lower denial rates, fostering continuous improvement in coding practices. CDI programs bridge the gap between clinical documentation and coding accuracy, ensuring the full complexity of patient care is captured. Clinicians, CDI specialists, and coders work together to improve documentation quality and support compliance. Risk management in coding involves identifying, assessing, and mitigating risks associated with coding, billing, compliance, and reimbursement. The major objectives are to reduce financial losses, prevent compliance violations, and improve operational performance. Major coding and billing risks include regulatory violations, revenue loss, fraud investigations, claim denials, audit findings, and reputational damage. Addressing these risks is crucial for maintaining financial health and compliance in healthcare organizations. A structured risk assessment cycle ensures that coding and billing risks are systematically identified, evaluated, and addressed before they escalate into significant financial or compliance events. CAPA programs involve identifying root causes of coding errors, developing action plans, implementing improvements, and monitoring results. These structured programs help reduce repeat audit findings and improve coding accuracy. Compliance monitoring programs include ongoing audits, coding reviews, and documentation monitoring. These activities ensure coding specificity and compliance, supported by oversight tools like performance dashboards and risk reporting. Technology plays a crucial role in supporting audits and quality assurance, with tools like coding audit software, AI-powered error detection, documentation analytics, risk monitoring platforms, and compliance dashboards enhancing efficiency and accuracy. Future trends in coding audits and risk management include predictive audit analytics, real-time coding validation, automated compliance monitoring, AI-powered documentation review, intelligent risk detection, and continuous quality assurance. In summary, coding audits, quality assurance, and risk management are essential for maintaining coding accuracy, ensuring compliance, and supporting continuous organizational improvement. Embracing technology and structured programs enhances these efforts, leading to better financial and operational outcomes. Welcome to Chapter 12. Specialty Coding, where we delve into the intricacies of coding for inpatient, outpatient, emergency, surgical, and specialty services. This chapter is essential for understanding the nuances of healthcare coding and advanced practices. Specialty coding requires a deep understanding of various healthcare settings, from hospitals to specialty practices. Each environment has unique coding requirements, documentation standards, and reimbursement rules. Coders must grasp clinical workflows and advanced coding guidelines to excel. Specialty coding involves applying diagnosis and procedure codes to specialized healthcare services across different medical settings. Major areas include inpatient, outpatient, emergency department, surgical, and specialty practice coding. Accurate specialty coding is vital for financial performance, compliance, and clinical quality across all healthcare settings. It ensures accurate reimbursement, improves compliance, enhances documentation, and optimizes revenue. Inpatient coding involves coding services provided to patients formally admitted to a hospital. It requires a thorough review of the entire medical record from admission through discharge, using common documentation sources like admission notes and diagnostic reports. The inpatient coding workflow follows a structured sequence from admission documentation review through final code assignment and verification. It involves reviewing the entire medical record, identifying principal and secondary diagnoses, assigning procedures, and applying coding guidelines. The principal diagnosis is the condition chiefly responsible for the patient's hospital admission. Accurate selection is crucial as it determines reimbursement, supports clinical reporting, and influences quality metrics. Outpatient coding applies to services where patients receive treatment without formal hospital admission. It follows the first listed diagnosis convention and is used in settings like clinics and diagnostic facilities. Outpatient coding follows a streamlined workflow focused on encounter-level documentation and payer-specific requirements. It involves reviewing documentation, assigning diagnosis and procedure codes, verifying medical necessity, and applying payer guidelines. Emergency department coding presents unique challenges due to high patient volume, time-sensitive services, and variable complexity. Coders must be proficient across virtually every clinical specialty and work under pressure to interpret incomplete notes. Emergency department evaluation and management coding is driven by the complexity of medical decision-making and the resources utilized during the encounter. It involves patient assessment, treatment complexity, and resource utilization. Surgical coding involves reviewing operative reports to identify procedures performed and assign captain codes. It requires applying modifiers and verifying documentation to ensure all coded procedures are clearly supported. Complete and accurate operative reports are essential for proper surgical code assignment. Coders must verify that all required elements, such as procedure details and complications, are present before finalizing codes. Orthopedic coding encompasses a wide range of musculoskeletal procedures requiring precise knowledge of anatomy, surgical approaches, and implant documentation. It includes coding for fractures, joint replacements, and sports medicine. Cardiology coding spans diagnostic testing, interventional procedures, and complex cardiac surgeries, each with distinct documentation and coding requirements. It includes stress testing, echocardiography, and cardiac catheterization. Radiology coding often requires careful review of both physician interpretations and imaging procedures. The professional component and technical component may be separately billed depending on the setting. Laboratory and pathology coding requires familiarity with clinical testing panels, specimen handling, and the distinction between technical and professional components. It includes genetic testing and specialized diagnostic services. OB/GYN coding encompasses the full continuum of women's healthcare, from prenatal visits through delivery and postpartum care, as well as gynecological procedures. It includes prenatal care, delivery services, and women's health services. Specialty coders face a complex landscape of documentation, regulatory, and compliance challenges that require ongoing education and vigilance. These include complex documentation, frequent coding updates, and compliance risks. Emerging technologies are transforming specialty coding by improving accuracy, efficiency, and compliance across all healthcare settings. These include computer-assisted coding, artificial intelligence, and coding validation systems. In summary, specialty coding requires advanced clinical understanding, structured documentation review skills, and detailed knowledge of coding guidelines. Accurate specialty coding improves reimbursement, supports compliance, and ensures proper representation of healthcare services across various settings. Explore the comprehensive guide to transforming raw financial data into actionable insights that drive revenue cycle excellence in modern healthcare organizations. Modern healthcare organizations generate vast amounts of financial, billing, coding, and reimbursement data. Effectively analyzing this data can improve collections, reduce denials, optimize workflows, and increase profitability. Medical billing analytics transforms raw financial data into actionable insights that improve revenue cycle performance and strategic decision-making. Medical billing analytics involves collecting, analyzing, and interpreting billing, coding, claims, and reimbursement data to improve financial performance. Core objectives include improving revenue, reducing denials, increasing collections, optimizing operations, and supporting strategic decisions. Revenue analytics improves financial visibility, identifies revenue leakage, supports operational efficiency, enhances reimbursement, improves compliance, and supports growth strategies. It provides a clear, real-time view of revenue cycle performance across the organization. KPIs are measurable indicators used to evaluate the effectiveness and efficiency of revenue cycle operations. They guide management decisions and performance improvement initiatives. Benefits include performance measurement, trend analysis, goal tracking, and continuous improvement. A comprehensive KPI framework spans financial, operational, and clinical dimensions of the revenue cycle. Categories include financial KPIs, claims management KPIs, coding KPIs, denial management KPIs, patient financial KPIs, and operational KPIs. Net collection rate measures the percentage of collectible revenue successfully collected after contractual adjustments. It identifies revenue losses and supports financial planning by informing budgeting and revenue projections. Days in AR measures how long it takes to collect payments after services are provided. Lower AR days indicate a more efficient revenue cycle and healthier cash position. Organizations with lower AR days maintain healthier cash flow and operational flexibility. Clean claim rate is the percentage of claims accepted on first submission without errors, denials, or rejections. Benefits include faster reimbursement, reduced administrative costs, and improved revenue cycle efficiency. Denial rate analysis identifies the percentage of claims denied by payers. It highlights common denial categories such as coding errors, eligibility issues, authorization problems, and documentation deficiencies. Proactive denial prevention is more cost-effective than retrospective appeals. First pass resolution rate measures the percentage of claims paid upon first submission without requiring rework, resubmission, or appeal. It reduces costs, improves productivity, and accelerates revenue collection. Coding productivity and accuracy both increase with experience, reinforcing the value of ongoing training and professional development. Key metrics include charts coded per day, accuracy rate, coding turnaround time, audit scores, and documentation query rates. Revenue leakage represents money that could have been collected but was lost due to process failures, errors, or missed opportunities. Identifying and closing these gaps is critical to financial sustainability. Systematic analysis of payer behavior enables organizations to identify underperforming contracts, negotiate better terms, and prioritize collection efforts strategically. Key dimensions include reimbursement rates, payment timeliness, denial trends, and contract compliance. Patient payment behavior trends show growth in online payments and payment plan utilization across all quarters. Key dimensions include patient payment trends, outstanding balances, collection rates, payment plan utilization, and financial assistance programs. Benchmarking provides the external context needed to interpret internal performance data and identify meaningful improvement opportunities. It includes industry benchmarking, peer comparison, performance targets, and best practices evaluation. Estimated revenue impact of each optimization strategy when fully implemented across the revenue cycle. Strategies include improving documentation quality, enhancing coding accuracy, denial prevention, patient collections, and payer contract optimization. Predictive analytics leverages historical data, machine learning, and statistical modeling to anticipate future revenue cycle events before they occur. It includes predicting claim denials, forecasting cash flow, predicting patient payment behavior, identifying revenue risks, and supporting strategic planning. Business intelligence capabilities include real-time monitoring, trend analysis, decision support, executive reporting, and KPI tracking. Executive Revenue Cycle Dashboard compares current KPI performance against organizational targets across key metrics. The next decade will bring transformative changes to healthcare revenue cycle management, driven by advances in artificial intelligence, automation, and real-time data intelligence. Key trends include AI, machine learning, automated financial forecasting, real-time revenue monitoring, intelligent claims analytics, and predictive revenue optimization. Advanced medical billing analytics and KPI management enable healthcare organizations to optimize financial performance, improve reimbursement outcomes, reduce denials, enhance operational efficiency, and support strategic decision-making. Organizations that invest in analytics capabilities today are building the foundation for sustainable financial performance and competitive advantage in an increasingly complex healthcare environment. Chapter 14 delves into how artificial intelligence, automation, and emerging technologies are revolutionizing medical coding. This comprehensive exploration highlights the transformative impact on medical billing and coding processes. Medical billing and coding are undergoing a significant transformation driven by AI, machine learning, and digital health technologies. Future coding professionals will work alongside intelligent systems to enhance accuracy and productivity. Medical coding has evolved from manual processes to AI-powered systems. This transformation reflects decades of technological advancement, enhancing efficiency and accuracy in handling vast records. Artificial intelligence refers to systems performing tasks that require human intelligence, such as reasoning and problem-solving. AI elevates coders' capabilities, enhancing their strategic value. AI is transforming medical coding through automated suggestions, documentation analysis, and error detection. These applications enhance productivity and compliance, ensuring efficient coding processes. Computer-assisted coding accelerates the coding workflow by analyzing clinical documentation and recommending codes. It bridges the gap between raw clinical text and compliant, optimized codes. Natural language processing allows computers to understand and interpret human language, transforming clinical documentation into actionable coding intelligence. NLP systems enhance coding accuracy and efficiency. Machine learning models analyze historical data to predict claims, detect fraud, and optimize coding. This technology continuously refines processes to maximize reimbursement and efficiency. RPA uses software robots to handle high-volume tasks in the revenue cycle, freeing human coders to focus on complex tasks. This automation enhances efficiency and accuracy in medical billing. AI-driven CDI reduces physician query rates and accelerates the coding workflow by surfacing documentation gaps before they become billing problems. Predictive analytics uses historical data and machine learning to forecast cash flow, identify revenue risks, and optimize billing strategies. This approach enhances financial planning and decision-making. AI systems identify compliance risks before claims are submitted, shifting the compliance model from reactive auditing to proactive safeguarding. This approach minimizes financial penalties and reputational damage. Intelligent claims processing platforms transform billing workflows into dynamic, self-optimizing systems, reducing acceptance times and improving efficiency across all payer levels. Blockchain technology introduces a decentralized ledger to healthcare billing, ensuring transparency, security, and trust across the reimbursement ecosystem. It enhances transaction security and data integrity. Cloud computing enables coders to work securely from anywhere, enhancing scalability, data security, and collaboration. This technology supports efficient and resilient coding operations. AI-powered systems process claims faster, improve accuracy, and enhance productivity. They reduce costs and support strategic decision-making, leading to better compliance and financial outcomes. AI adoption in medical coding faces challenges like implementation costs, data quality issues, and cybersecurity risks. Addressing these challenges requires strategic frameworks and human change management. As AI handles routine tasks, medical coders evolve into roles requiring clinical knowledge, compliance expertise, and technology fluency. They become validation specialists, compliance experts, and more. Emerging technologies like generative AI, digital twins, and smart healthcare ecosystems are reshaping medical coding. These innovations enhance efficiency, accuracy, and integration across the industry. By 2035, the revenue cycle will operate as a self-optimizing intelligent ecosystem, maximizing reimbursement and ensuring improved financial performance with minimal human intervention. AI and emerging technologies are transforming medical coding by enhancing accuracy, efficiency, and compliance. Future professionals must combine deep clinical knowledge with the ability to collaborate with AI systems. Chapter 15 delves into the professional certification, career development, and future of medical billing and coding. This comprehensive guide is designed to help you build a successful career in healthcare revenue cycle management, from foundational skills to advanced expertise. Medical billing and coding professionals play a crucial role in healthcare finance, compliance, and revenue cycle management. As the industry evolves, the demand for skilled professionals continues to rise. Success in this field requires a blend of technical knowledge, compliance expertise, continuous learning, and professional certification. Over the past 3 decades, the medical billing and coding profession has transformed from manual systems to advanced, AI-powered ecosystems. This evolution includes the shift from paper-based systems to electronic coding, revenue cycle management integration, and intelligent healthcare finance systems. Medical billing and coding professionals are vital for supporting healthcare revenue, improving reimbursement accuracy, ensuring compliance, and reducing claim denials. Their work optimizes financial performance and supports healthcare analytics, making them indispensable in the healthcare industry. Mastery in medical billing and coding requires a broad set of competencies, including clinical and coding knowledge, operational and technical skills. These competencies are essential for navigating the complexities of healthcare finance and ensuring accurate and efficient billing processes. Top-performing professionals in medical billing and coding possess essential soft skills such as attention to detail, critical thinking, problem-solving, communication, time management, and analytical thinking. These skills distinguish them in the workplace and enhance their effectiveness. The field of medical billing and coding offers a wide range of career opportunities, from entry-level roles like medical coder to specialized positions such as compliance analyst and revenue integrity analyst. Each pathway provides unique challenges and rewards, catering to various interests and expertise levels. Experienced professionals in medical billing and coding can advance into leadership, consulting, and strategic roles that shape the financial future of healthcare organizations. These advanced opportunities include positions like coding manager, healthcare compliance officer, and healthcare consultant. Professional certification is a powerful differentiator in the competitive healthcare job market. Certified professionals demonstrate stronger coding accuracy, compliance awareness, and career advancement opportunities, leading to enhanced knowledge, increased credibility, and competitive advantage. In a field defined by constant regulatory change and technological advancement, continuous learning is essential for sustained career success. This includes ongoing education, technology skills development, industry updates, coding guideline changes, and compliance training. Staying current with annual coding updates, regulatory changes, reimbursement policy changes, technology advancements, and industry best practices is crucial. Professionals who fail to stay current risk coding errors, compliance violations, and career stagnation in a rapidly evolving field. Revenue cycle management expertise is the cornerstone of advanced career development in healthcare finance. Future leaders combine coding precision with financial and operational acumen to drive organizational success. Technology proficiency is essential for modern medical billing and coding professionals. This includes navigating EHR systems, operating revenue cycle software, leveraging analytics platforms, and utilizing AI and automation tools. The digital transformation of healthcare has unlocked a world of remote and global career opportunities for skilled billing and coding professionals. These roles offer flexibility, growth potential, and competitive compensation. Experienced professionals who develop leadership capabilities can shape the strategic direction of healthcare revenue cycle operations. Leadership opportunities include team leadership, process improvement, quality management, strategic planning, innovation management, and compliance leadership. The convergence of AI, automation, and data analysis is creating new career categories in healthcare revenue cycle management. Emerging roles include AI coding specialist, healthcare data analyst, and digital revenue cycle consultant. The road ahead presents both challenges and opportunities for healthcare revenue cycle professionals. Key areas include automation adoption, workforce transformation, regulatory complexity, cybersecurity requirements, and data analytics expansion. The next generation of healthcare revenue cycle management will be defined by intelligent automation, predictive analytics, and real-time financial intelligence. This future promises enhanced efficiency and strategic planning capabilities. By 2035, healthcare revenue cycle management will transform into a fully intelligent, data-driven ecosystem. This vision represents a complete reimagining of healthcare finance, where human expertise guides intelligent systems toward optimal financial and clinical outcomes. Becoming an advanced medical billing and coding professional offers numerous benefits, including professional recognition, career growth, industry-relevant knowledge, and enhanced employment opportunities. Certification covers essential areas like medical coding, revenue cycle management, and healthcare technology. Congratulations on completing the Advanced Medical Billing and Coding Professional Program. You've mastered key areas like medical billing fundamentals, ICD-10-CM diagnosis coding, and more. This comprehensive journey equips you with essential skills for modern healthcare revenue cycle management. Experience the flexibility of learning anytime, anywhere with our 100% online platform. Enjoy self-paced learning, comprehensive study materials, and online examinations. Our digital certification is globally recognized, and the platform is accessible to healthcare professionals worldwide. CDG Training offers industry-focused courses designed to meet current demands. Gain practical revenue cycle knowledge and enjoy a flexible learning environment. Our professional career advancement opportunities and international learning community set you up for success in healthcare. Thank you for choosing CDG Training as your partner in medical billing excellence. We focus on medical billing excellence, coding accuracy, and revenue cycle success. Our compliance expertise and professional growth opportunities ensure your continued success in the healthcare industry.